Assalamu alaikum. The paper for this week is titled Prevalence of Apical Periodontitis in Patients with Autoimmune Disease. It's a case control study published by Allihaibi et al. In 2023 in International Endodontic Journal. Basically, autoimmune disorders are a group of disorders that have variable clinical manifestation but share a self-reactive immune response as a common etiology, which include inflammatory bowel disease or chronic inflammatory condition of the gastrointestinal tract, which is caused by an imbalance of pro-inflammatory and anti-inflammatory factors. Rheumatoid arthritis is a chronic inflammatory joint disorder that causes joint pain, swelling, and damage, which is possibly caused by a combination of infectious agent, autoimmunity, and genetics. Psoriasis is a chronic inflammatory condition that predominantly affects the skin and is strongly associated with the genetic susceptibility and autoimmune traits. The current standard of care for chronic inflammatory disorder advocates the use of conventional disease-modifying anti-rheumatic drugs as a first-line treatment. But for the cases that do not respond to conventional disease-modifying anti-rheumatic drugs, additional treatment with biologic disease-modifying anti-rheumatic drugs is recommended, which are frequently directed at a particular target in the immunological inflammatory process, such as cytokines, the receptor activator of nuclear factor kappa B ligand, T or P cell receptors. And their objective is to either diminish or block these targets' activity. And TNF-alpha is the molecule most often targeted by these new medications. Recently published research suggested that the biological treatment might influence the progression of apical periodontitis. Therefore, the aim of this study is to compare the prevalence of apical periodontitis in patients with autoimmune disease under treatment with conventional biological or no treatment, with the prevalence of apical periodontitis in subjects not affected by autoimmune disorder. Regarding the methodology, all participants were identified through the conducting of search in hospitals' electronic patients record system. 89 patients with autoimmune disease were investigated, and the control group include 89 patients with no systemic disease as well. Full dental panoramic radiograph were used to determine the periapical status of the teeth. One senior endodontic postgraduate student and one endodontic specialist assessed the periapical status of the teeth. Additional variables investigated include patients' socio-demographic characteristic, medication taken by autoimmune disorder patients, the decayed, missing, and filled teeth, DMFT index. And then the chi-square test and logistic regression analysis were used to evaluate the correlation between the autoimmune disorder and the apical periodontitis. The results showed that the prevalence of apical periodontitis was 89% in the autoimmune disorder patients and 74 in control subjects. The DMFT score was found to be significantly higher in the AD group. Patients with rheumatoid arthritis had the highest risk of being affected by apical periodontitis, whereas those with inflammatory bowel disease had the lowest risk. Then multiple binary logistic regression analysis indicated that teeth of autoimmune disorder patients who were not taking any medication or were being treated with biologic disease modifying anti-rheumatic drugs had a higher risk of being affected by apical periodontitis than did the teeth of the control subjects. And the teeth of patients taking conventional treatment were less affected by apical periodontitis compared with those patients taking the biological treatment. In conclusion, patients with autoimmune disorder, whether treated or not with biological medications, showed a higher prevalence of apical periodontitis than did those in the control group. DMFT index score, which was higher in autoimmune disorder patients compared with control, was identified as a significant predictor of apical periodontitis prevalence. Thank you.